Hello, good afternoon, Miss Doe. I'm Lawrence. I'm a student registered nurse anesthetist, and we will be performing a block for you today. I saw that you'll be having a right shoulder arthroscopy, and we're planning on doing an interscalene block on you. That's essentially a block that we place right here by the neck, and it'll help. Mainly, it's used for right shoulder arthroscopies, shoulder surgeries, or your clavicle, your collarbone surgeries, or any upper arm procedures. So for this particular procedure, it, it'll be used for the right shoulder arthroscopy. Um, so for complications regarding this um, interscalene block is since we're accessing on the neck area, um, some of the nerves there involve complications, including right-sided weakness with breathing, because one of the nerve roots that are targeted there could possibly affect that root. That could affect your breathing on that right side, to where you'll be having the procedure from. Also, low blood pressure and low heart rate. Also, possible complications that may involve with this is what we call Horner syndrome, in which one side of your face, you'll have your eyelid would have um, one of your eyelids will be weak, and also your you guys also have a side effect of one-sided um, sweating on the left side, and then your other side is not sweating, which is on the right side usually where we perform the block. And also let me think. Also the risk of possibly puncturing the lung, because it's nearby that area, and also risk of infection and risk of bleeding or hematoma, meaning blood collecting underneath the skin. Those are some of the risks involved with this procedure. But basically, what will happen with this procedure is that we'll be giving a local anesthetic in this area that will cover the nerve roots that's radiating from here down to your upper shoulder, to the collarbone and to the upper arm area, and that'll help with your procedure. And basically, we're gonna give it a little bit of a skin wheel, a small, and inject a little bit of local anesthetic there, so you won't feel when we actually insert the needle. We're gonna use an ultrasound probe to look for any we're gonna look for our landmarks, and essentially find the nerve root where we'll be accessing the needle. And essentially, when we access it through the skin, we're going to make sure that we bathe the nerve roots to where you'll have coverage, and you're not going to be hurting on your right shoulder as much. And those are the benefits. Include pain coverage, post-operative pain management, and you're not going to be feeling much about your right shoulder being in pain. And essentially, this is beneficial for you compared to a general anesthesia, because it's only localized here, and you're not going to be asleep. Although we will give you medicines to help you relax during this procedure, and that you may not be aware of what's going on while this right shoulder arthroscopy is ongoing. If you have any questions, please let me know. And if you could sign the consent for me here, and that would be greatly appreciated. And I think that's it. And also, before I forget, one of the risks involved whenever we do any kind of local anesthetic or any kind of peripheral nerve blocks is the risk of what we call LAST, which is a toxicity that involves local anesthetics. And essentially, it's a risk of injecting it in a vessel that would cause seizures and cardiovascular collapse or possibly death. But those risks are rare because we will be visualizing it with a probe while we're accessing the nerve, and essentially we're not going to access any, we're going to prevent that by using the ultrasound and actively real-time visualizing where we're going to be injecting local anesthetics, so you'll be pain-free throughout the procedure. Thank you so much, and I appreciate your time.